Let us continue with the part 2 of the digestive system question and answer. Every question and answer that you will do, you will definitely strengthen your guideline and the concept. So please do the maximum practice before you appear for the CPC exam. So we will begin with the question. My format will remain the same. You will read the question and try and solve it. And in the next slide, we will try and solve the. So what is this? Let us find out our data. So it is the case of the acute appendicitis, and in this case the doctor has done the laparoscopic evaluation and repair for this appendicitis, and what they have done is they have removed the appendix, and for which they have used the base of the appendix is divided and the appendix is removed. So the appendectomy has been done, but it is done by the laparoscope. So we have the code 44970, 960 and 979, and if you see the code, the 44970 is the most appropriate code because it's talk about the laparoscopic appendectomy without rupture, and there was no mention of the rupture in the case, so we can zero down that answer. So this is the operative report. Try and pay attention to the procedure description that will give you data to zero down your code. Now what has happened here is the patient is having the chronic cholecystitis, and for which the laparoscopic cholecystectomy, that is removal of the the gallbladder has been done, because chola is the gallbladder and removal of the gallbladder has been done. And in this case we need to check the code, and how that gallbladder has been removed is laparoscopically. So if you see the code, the 47562 is a laparoscopic cholecystectomy standard gallbladder removal, and 47564 is a laparoscopic cholecystectomy with the exploration of the common bile duct. So the gallbladder appears chronically inflamed. Dissection proceed to identify the cystic duct and artery, which were clipped twice proximally, once distally, and the gallbladder was then detached from its bed using the electrocautery. So there is no the exploration of the common duct that has happened. So we cannot take the code 47564 and 47610 and 600. Out of that, they also talk about the cholecystectomy. Now what is this code? These are for the open procedure, and in our case it is very clearly given it is a laparoscopic, so we will go with the code 47562, and kindly check the code K81.1, and that is the code for the chronic cholecystitis. Next question. So let us understand what has happened here. The procedure that has happened is ERCP, endoscopic retrograde choleangiogram, that has happened, and with a balloon choleangiogram and stent exchange and enteral biopsy. So the two procedures are being performed, the stent exchange and the enteral biopsy. So if you see the code A, it is eliminated because it is only the diagnostic ERCP. And if you see the code C, it is eliminated because the add-on code is to visualize the pancreatic or common bile duct, which isn't done in our question. So in between B and D, we will have to now see the correct answer. And if you see the D is incorrect because it talks about the removal of the calculi, and the removal hasn't happened. What has happened is the stent was not, it wasn't working well, so they have removed the stent and was deployed for the biliary drainage, and after that even the enteral biopsy was done. So we will go with the code 43276 and 43261, and because these are the two separate procedure and the two procedure which are happened in the same session, we will write the modifier 51. So the question is pretty straightforward, and we have done one question earlier. So it is the question of the acute cholecystitis, and for which the procedure what they have done is a cholecystectomy. And remember, whenever any removal of the organ is done, you must pay attention how they have carried out that procedure. Is it by the open method or laparoscopy? If it is a laparoscopic, pay attention to the words like trocar, camera, video assisted camera, or smaller incision. And if it is the open method, then you pay attention to the word laparotomy or the suturing. All that will help you to understand. And so the answer will be 47562, because we have the 47600 and 605. They talk about the open method of the cholecystectomy. Now let us collect our data. What has happened is the patient is having ascites. Ascites means the collection of the fluid. Abnormal collection of the fluid in the abdominal cavity is called as ascites. And what they have done is they have used the procedure to withdraw the fluid from the abdominal cavity, which is called as a abdominocentesis, or the other word is paracentesis. And they have used the ultrasound guidance. Now, if you see on the code 49082, it talks about the code describe the abdominal paracentesis performed without the use of image guidance. In our case, we have used the image guidance. So 0882 is not the correct code. 49180, it talks about the code describe the percutaneous needle biopsy that hasn't happened. And 49083, it talks about describes the abdominal paracentesis performed with the use of image guidance. Now, when this wording is there in the code, there is no need of using the additional code for the image guidance. And there is a parenthetical note under the procedure 49083 that state do not report 49083 in conjunction with this code. And so we cannot even take the any of this, so the correct answer is 49083. So this is the the operative report, and in CPC question you will have operative report per system, and Whenever the operative report is there, the length of the question is very long, and just looking at the question length, sometimes the student gets panic. Do not panic. Read the description and the procedure, because here the procedure is Hartmann procedure, which is a sigmoid resection with Hartmann pouch, and colostomy. Colostomy means creating the opening and in the colon. So that should give you some hint. So, what is this procedure? This is the procedure where the colostomy has been done and Hartmann pouch. That is the name of the Hartmann type procedure. That is the name of that procedure. And in this case, this particular procedure is carried out by using the blunt dissection. I do not see the word laparoscope anything, and so we will check the code 44140. It talks about the colectomy partial with anastomosis. Then 44143, it talks about colectomy partial with end colostomy and a closure of the distal segment, Hartmann type procedure. 44160, it talks about the colectomy partial with removal of terminal ileum with ileocolostomy. That I do not see happening, because what we are dealing only with the large intestine. We haven't even gone into the small intestine. And then we have the code 44208. It is the laparoscopic approach, because that is also the colectomy, but it comes under the laparoscopic approach. And in our case, the approach is open approach. So 208 goes away, and 44143 talks about the Hartmann type procedure, and that's what the name of the procedure that has been given in our data. And so we will pick up the code 44143. So let us look at our case. In this case, the patient was admitted with a gastric dilation, and they decided to go for the EGD, that is a esophagogastroduodenoscopy. And they reached till the stomach, and the stomach showed 20 to 30 tablets. And the stomach was very distended, and there was a narrowing of the pyloric channel, and the scope couldn't reach till the duodenum, and they couldn't examine the duodenum, and repeat examination is not planned. This is a very important sentence, because we have a guideline in CPT that if the reason is given why the duodenum was not examined, and if the repeat examination is not planned, then we will put the modifier 52 to the EGD. And if you see the code 43246 and 241, the 241, it talks about the esophagogastroduodenoscopy flexible transoral with the insertion of the intraluminal tube or catheter, and 246, it talks about with a direct placement of the percutaneous gastrostomist tube. We have not placed the tube. We have just checked the distended stomach, and then we withdrew the catheter, or the intraluminal tube means the camera which was fixed to the scope. And that's why 43241 with the modifier 52 is the correct answer. So let us see what is this case. It is a 55-year-old patient underwent repair of initial left inguinal hernia. The incision was made at the groin, and a hernial sac was readily identified, cleared, and even they have put the mesh, and the total defect was 2.8 centimeter. Now, according to the new code, what we look for is the what is the type of the hernia, whether it is a initial or the recurrent, and then we also look for the we don't look for how the procedure has been carried out, and here it is carried out by the open method, but that is not a consideration. But what is the consideration is the length of the defect, and our defect is 2.8 centimeter. So we will go for the code 49613 because it is the repair of the anterior hernia, and any approach that is given recurrent, including the implantation of the mesh. And so we don't code for the mesh separately, but the defect is been shown as less than 3 centimeter. Our defect is 2.8 centimeter. And 49623 is the removal of the mesh, which is removal of total or near total non-infected mesh or other. We have not removed the mesh, but we have put the mesh, and the mesh putting is the part of the code. So we will go with the code 49613. Now let us collect our data. In this case, what has happened is the patient had acute cholecystitis, and his liver function test was abnormal. And so with the help of laparoscope, they placed the epigastric incision with the insertion of the port, and they have removed the gallbladder because there were several stones, and they removed the gallbladder. And then what they have done is the cystic duct, the common bile duct was incised and large stone was removed, and the common bile duct is closed and connected to the drainage tube placed outside the abdominal wall into the bowel bag. So in this case, the colostomy, that is incision of the bile duct, that has happened. Then and was done for the removal of the stone. And cholecystectomy, a stoma was made in the abdominal wall from the bile duct for the drainage. So the cholecystectomy, and cholecystectomy, these three procedure has happened. They cut open the bile duct, but they did not take out the bile duct, but they removed the gallbladder, and they have put the drainage, which is called as a cholecystectomy, stoma creating the stoma. So for this three procedure, if you see the code 47420, it talks about cholecystectomy. Okay, so those two things that has happened, but this particular code does not talk about the cholecystectomy, and for that we will use the additional code, that is 47562, and that code talks about laparoscopic removal of the gallbladder, and the medical terminology is a cholecystectomy. Now let us collect our data. What has happened is the elderly gentleman has a small bowel obstruction and the abdominal incision was done. So they have made the open procedure, and in this case what the doctor saw is there were full adhesion. So there were adhesion, and this adhesions were there till the interior abdominal wall. And for that, what they have done is they have cut they have separated the adhesion, and then they have cut the small intestine, and they have removed the small intestine because performing a limited small bowel resection. So, and dividing the intervening masonry and double staple anastomosis. Now, if you see the code 44120, it talks about the enterectomy, that is removal of the small bowel, resection of the small intestine, single resection, and they have done the single resection, and then anastomosis happened. So we will require a code 44120. 44125 is with enterostomy. They haven't created any opening into the small intestine. What they have done is they have done the enterectomy. So we will require the code 44120, and 44130, it talks about enter entero enterostomy, anastomosis of the intestine with or without cutaneous enterostomy, and that didn't happen. So we will require a code 44120. Now what is this code 44005? It is a enterolysis, that is the freeing of the intestinal adhesion, but in the bracket it is written as a separate procedure. Now we know what is a separate procedure. It is the term that is used to identify the services that are the typically performed as a part of the larger or more comprehensive procedure. Now in this case, what is the more comprehensive procedure is taking out the intestine. So whenever we do that procedure, then the 44005 is not coded separately, as it is considered an integral part of or a component when another intestinal surgical procedure is performed at the same time. And here what we have done is enterectomy we have done. So enterolysis will be the part of that. Another case report, pay attention to the procedure and to quickly go through the procedure, because sometimes we do get some hints from that. So let us see what has happened. It is the case of presence of the stone in the gallbladder, calculi in the gallbladder, and the patient is having the chronic cholecystitis. And the procedure that is done is cholecystectomy. Cyst is basically any sac. So whenever we say the word cholecystectomy is removal of the some kind of sac, and here it is a gallbladder removal. So let us go through the procedure. A laparoscope was placed at the umbilicus and the gallbladder, and a liver bed where visualized the gallbladder was enlarged and thickened, and there was the evidence of the chronic inflammatory changes. Two additional ports were placed and grafts were used to free the gallbladder from the liver bed with a combination of the sharp dissection and electrocautery. Cystic artery and duct are clipped, dyes injected in the gallbladder, cholangiography. So they have done the cholangiography as well, reveal no intraluminal defect or the obstruction, gallbladder is defected. So this is a clear-cut case of cholecystectomy along with the cholangiography. So if you see the code 47562, these are the codes. So 47562 is a laparoscopic surgical cholecystectomy, while 47563 is a cholecystectomy with a cholangiography. And Below that, if you see that there is a parenthetical note for the intraoperative cholangiography, radiological supervision and interpretation C74300 and 74301, and we have the code 74300, so we'll be using that code. 47562 talks only about the cholecystectomy, while 47605 and 600 it talks about the open procedure. As is the laparoscopic procedure, so we will zero down the answer B. See, some of these questions are very easy, and I can tell you that in CPC they do not ask this straightforward question. The questions are extremely smart, but just for the practice I have kept them. It is a EGD with a biopsy and dilation over guide wire. Now we have the code. So if you see the code 43241, the code 43241, it is the code which talks about the intraluminal tube or the catheter, while 43248 it talks about the with insertion of the guide wire followed by the passage dilation through the esophagus over the guide wire. So there is a dilation over the guide wire that has happened. So we will require a code 43248. Okay. And now what is this code 43239? Because what has happened, there are two things happened. There is a biopsy also happened and there is a dilation over the guide wire also happened. So yes, 43239 it talks about the biopsy, and the 43248 only talks about dilation over guide wire. It doesn't include the biopsy, and since biopsy has also happened, we will write both the code with the modifier 51. Another simple question. In this case, what has happened is the scope was introduced through the rectum and advances to the cecum. And in the cecum an AVM was noted, and the gold probe was utilized to perform the bipolar thermal ablation. So this is the case of the colonoscopy because the scope has introduced through the rectum and it has gone till the cecum. So we can utilize the colonoscopy decision tree, and what they have done is they have done the thermal ablation of the bipolar thermal ablation. That means it becomes a therapeutic scopy, because they haven't they did find something but they acted also on it, and that's why we will go here, and the scope has gone till the cecum. This is a thermal and therapeutic and then colonoscopy, and if you see here they have given the code range 45379 to 45398. So we'll be looking for the code from this category, and in that 379, so 378 goes away because it is mainly for the diagnostic, and in between 385, 380 and 388 will zero down our answer. Yes, so the code is 45388, and we see the method that they have used to destroy that lesion, and it is a thermal ablation. If you see the code 385, it talks about the snare technique, and 380 it talks about only the biopsy. So 388 is the most accurate code. So if you see the code 43249, it talks about the esophagogastroduodenoscopy, and it includes the balloon dilation in that. And if you see the code 43235, this particular code talks about the esophagoduodenoscopy, but it does not include the balloon dilation. So we have a specific code for that. So we would rather use that code. And 43226 is basically the insertion of the guide wire followed by the passage of the dilator. There is no mention of the word dilators or the passage of the guide wire. And even the 43200, it is the esophagoscopy, it is not a EGD. This is the case of a EGD, and this is esophagoscopy, what they have done. And here they have reached till the duodenum. So that is also one important consideration. So the 43249 is the code which talks about everything that is given in our encounter. So let us take this last slide, and in this case, it's a patient with an ongoing symptom of weight loss, constipation, and blood in the stool verified with the occult testing, underwent a rectal approach colonoscopy with a snare removal of the 3 colonic polyp. The pathology report, which was returned to the physician the same day of the procedure, revealed benign colon polyp. How should you report this procedure? So what is the data? So the data is pretty simple, that they did the colonoscopy, they found the colonic polyp, and that was removed by the snare technique. And whenever we are coding for the colonic polyp, how that polyp has been treated is also very important consideration for the code. And of course it is a benign colon polyp, so that also we have to take into consideration. So let us see what's the answer. So the answer is D, 45385, and that talks about the removal of the tumor or the polyps or other lesion by snare technique, and that is something which we have done. The C answer is wrong because it talks about 45378 and 385. 378 is a diagnostic, while 385 is the therapeutic or the surgical. And we have the guideline that if the surgical scopy has been done, we do not code the diagnostic. B is also 45385, but if you see the ICD code, they are all talking about the symptom, and here the benign colon polyp is the diagnosis. So we have a confirmed diagnosis. In that case, we will not write the symptom. And 44392 is also not the correct code. So after going through all that, what is the correct answer is 385. So here all the guidelines you must learn. So here we finish the part 2 of the digestive system, and there is one more part which I am planning to take, because the more the practice you will do, you will get better at it, and 100% you will clear your exam within the first attempt.